Beginning of the season, I'm Dr. Vijay. I'm an allergist and clinical immunologist with experience of more than 27 years in Pune. And as we are seeing an upsurge in cases of asthma, allergy, in children, it's the number one chronic disease in adults also. The cases of chronic minimal persistent inflammation leading to asthma, chronic respiratory disease, which is increasing only. So in our day-to-day practice also, we can improve our allergy practice, so including asthma and chronic respiratory disease. And a simple manners, you can have a better quality of life to your patients also. Because at present, even in 2020, when I delivered a lecture how the use, abuse, and overuse of anti-allergics and steroids in India, I found 90% of the patients are given oral or parenteral steroids to the allergy patients, and it has a lot of side effects. So, considering that, we should use a very safe medicines as well as we should have a very good relief also. Because why the steroids are used to have a best relief to the patient, but the long-term side effects are a lot. So we should have a relief also, and the safety of the medications is also very important. So already 2019 in Lebanon, the World Allergy Organization had said the novel approach to the allergy diseases has to be changed. And allergy is a hypersensitive disease. It's not a lower immunity. And that misconception should be removed again and again. It is a hyperreaction, hyperactivation of the mast cells from the different body parts or simultaneously at a one time, like a severe anaphylaxis and all. So even 2014, there was a research done, and in India, many cities, whatever the asthma patients, they felt like they are controlled, but 92% of the patients did not have even the spirometry, oscillometry, or nothing was done. And because of the genetic and environmental factors and chronic exposure to the indoor outdoor pollutants, adulteration, pesticides, lifestyle, and even the food allergy cases have increased up to 8 times admissions. And as the child grows, the cutaneous sensitivity from the dendritic cells in the skin to the grain dust and all, later on the oral food allergy and leading to the other aeroallergen sensitizations, which increases. And then the patient have a presentations from the nose or sinuses, eyes, ears, throat, lungs, and so this allergic march as a practical management, each and every practitioners like us should know that once allergy is always allergy till we don't manage it properly. So what does it mean? In between, if you see this picture, the eczema, 80 to 85% of the children they overcome the eczema as they grow up. But later on, they go into rhinosinusitis, rhinoconjunctivitis, asthma. So that's very worrisome. And then the patient has a multiple sensitivities, and the inflammation reaches to that level where the prior usual dose antihistaminic also don't work. So our role should be how in diabetes we manage the diabetes, and we want to prevent the complications, and the increase in the sugar level should be prevented. The same way here, the multiple allergen sensitivity and increase into the mast cell hyperactivation and the complications can be prevented very well. So you see already these are the allergens. They travel around many kilometers. Even the animal danders and 14 to 15 kilometers on somebody's hairs or and all. And like people talk about that, cancer is a second death causing disease, but you can see the COPD is very important. Even the 2017, the research has been done over there. You can see this child used to have a seasonal cold, but you can see the denim organ folds, David and nasal septum, the long eyelashes, and here the turbinate hypertrophy. The hidden signs should be picked up. It was a young girl with such a periocular eczema. You can see over here. Even she used to have oozing and secondary infections. Quality of life was so affected. She was in a depression. And when we did a testing, dust mite sensitivity, some foods were sensitive. Never she was tested for these things. And since childhood, she was just given a localized steroids and oral steroids. Sometimes obesity was significant. You can see this girl, same one. The turbinate hypertrophy is significant one. This why like in between she had a asthma also, and now she presented in a COPD asthma overlap also. This young adult, you can see the turbinate hypertrophy and the deviated nasal septum. And he had a rhinitis polyps and he was suggested for the surgeries also. This was another patient with a significant rhinosinusitis, the turbinates, and you can see such a significant turbinate hypertrophy is there. This was a young woman with a tonsillar adenoids. You can see the posterior pharyngeal hyperplasia also, and has a very bad sinusitis. So basically, the overimmune response. So to have an allergy, basically, the patient should have a good immunity. And the common allergen triggers have not been educated, like pollens, dust, spray, tenders, insect dropping. So you keep a form, it's a standard form, allergy questionnaire, international one, where all the symptoms from the childhood, whatever the patient have, you can ask the receptionist to record that. Ask each and every patient, I will say, any of the symptoms were there previously. And then looking at his job or student, then most of the schools nowadays, air conditioners are there. So even the ducts and all, they are not clean. The funguses can be there. So even the school bathrooms or kitchen or deep pockets of the cars and all. So comprehensive medical history is very important. So any triggers, any irritants. So most of the people will talk about spicy food or some banana or some fruits and all. But there is a cross reactivity of that with the birch pollen, latex sensitivity, or even the prawns sensitivity to the derpy one cross reactivity can be there. So this is an allergy questionnaire. Here you can see all from respiratory to eye to the skin, gastrointestinal, and others like asthma and all. People don't know this is an allergy. Like even the throat clearing, a lot of people go on doing they go on sneezing out and taking out the mucus and all from the nose. Then which season? Then what type of like what are the triggers? Is it daytime? So depending on that, we can come down to the specific allergens. The selected allergens testing is more important than whatever the people go to the labs and do so many panels and all. It's not useful. This is very important. Then conduct a proper physical examination. If the patient comes to you for any skin allergy also, don't miss out the hidden signs of allergy, like long eyelashes, dark circles, denim organ folds, like these signs. Then there is a area line. Then always check for the ears also. There can be a eardrum can be affected. Retracted drums can be there because of the chronic eustachian tube inflammation. Any eczemas or dry skin, 70% of the rhinitis asthma patients have a significant atopic dermatitis. So from their perspective, their main concentration will be with the respiratory. But if you clinically examine properly the skin, you'll find out a significant dryness and all. Even in the eyes, you always look for any palpebral papillae or something. Rubbing muddy sclera can be there, watering, discharge. Then auscultate the lungs also, not only physically. Even we'll see later on how. So these allergic shiners or because of the rubbing and all, that can cause a capillary breakage. And this bullous muscle spasm can be there, watering of eyes, an open mouth, facial, even grimaces or the denier line on the allergy line, we can call like this allergy mannerisms, how the patient do that, and this hypertrophy indeterminate posterior pharyngeal hyperplasia. These hidden signs like cobblestone appearance and atopic dermatitis, cervical lymphadenopathy, which is very common in the children. These eye allergy symptoms should not be missed. This is 95% of the patients have these, and we can have a very good relief to these ocular allergies with a very uh, uh, safe medications so that the repeated eye steroids should not cause early age cataract and glaucoma. So you can see different type of presentation of eye allergy and these symptoms. These are very common nowadays, and these are missed by most of the patients. Just repeated eye steroids. Even allergy testing on the back or on the hands, forearms, and all can be done. Only thing it requires a very good experience. My teacher used to say 30,000 patients you should have so that each and every prick it should be uniform so that there should not be false positive and false negative. So education and time giving to the patient is most important. So repeatedly we have to educate about the pollens, dust mites and all because in India still most of the people they feel like food allergy, but it cannot be there. So we have to make them. Then individualized treatment plans, like depending on the like suppose there is anaphylaxis, keep the auto injectors, or we can have our own form like 0.5 ml regular adrenaline ampoules. We can take into the usual syringe and keep it that in a spectacle case or something. It can be kept for 3 to 6 months till the discoloration does not happen. Then emergency corticosteroids. And for the long-term management, the desensitization and precautions to that patient should be educated. So there cannot be a one drug only to relieve for all the symptoms. So depending on that, follow the appointments. Give the patient time. If you don't have a rush, don't give a time during that time. When there is not a rush, ask the patient to follow up accordingly, and you can have a very good day. Then, as I mentioned, the adrenaline ready-to-use pens are available outside, but in India, we can have our own form of that, depending on 10 kg child, zero point 0.1 ml, 20 kg, zero point 0.2, 30 kg, zero point 0.3 ml, above that, 0.5 ml. Keep yourself updated on the latest developments in allergy management. Attend relative conferences, webinars to stay informed because each and every time, still after so many years, I am still learning these things. And so the same way, there are always like biologics, therapies, and all have come up. Then allergens also they may change depending on some of the trees will be vanished, or even like Pune like city we have found now bad dropping allergy, pigeon feather droppings, pigeon feather 17 types of dust mites are into that. Collaboration is very important. Whatever the family physician, ENT surgeon, asthma specialist, dermatologist, eye specialist. Like as I mentioned, allergic rhinitis patient, 95% of the ocular allergy that is missed. So always refer to the ophthalmologist also to see under the slit lamp and guide the patient about that. Because symptomatic management of rhinitis or asthma or skin allergy is not important. Even long term, the patient should not have a vernal keratoconjunctivitis or early age cataract glaucoma or keratoconus. Record keeping, always keep the records. Last 27 years, I'm having all the allergy patients or any other patients also. I've kept the records. It does not require much admissions and all after 10 years you can remove, but at least keep something on the Excel sheets and all nowadays. It's very important. Even we have the softwares and all. Along with the medications, already the medicines and all we have learned in other lectures, but a practical like changing the bed sheets, then the pillow covers can be washed into the hot water, then HEPA filter, vacuum cleaners, plasma clustering technology, air purifiers, then pollen filters can be kept into the car ACs. Nowadays, even the vents of the car can be covered with the proper pollutant filters are there. And patient support. So these patients are already frustrated. A lot of atopic dermatitis children or rhinitis, rhinosinusitis children, adults also are frustrated. So give them a support like this. Disease can be completely reversed. The patient can have a very good control on the symptoms and they can enjoy the life till long, and we can prevent the complications also. And as well as the seriousness also is very important. A lot of people they feel ki their grandfather has asthma, the father had asthma, mother had something, and nothing happened. But previously the potency of the allergens was not much, but now the potency has increased a lot. So because of the pollutants and all the particles when they sit on the pollens and all, the potency increases. So the complications are going to be keratoconjunctivitis, asthma, chronic obstructive pulmonary diseases, even the heart is in between the lungs. So whatever the affection into the airways and lungs is going to cause a 30% severe asthma patient can have a cardiac problems, paralysis into the obstructive sleep apnea, snoring patients. So allergy management can be made very easy with the simple tips for an effective OPD practice. And if you give a small time, and as I mentioned, keep the form allergy questionnaire. You may not need to give that much time. Your receptionist, anybody can be trained into that. And then you just have a look at that, ask some positive history, and you can note it down then. Then make a proper diagnosis. Allergen avoidance after the standardized allergy test. That is a basically job of a qualified allergy specialist. So you can refer to the proper experienced allergy specialist. Then which safe medications and all already we have discussed in other lectures. Patient education is the most important because there is a lot of myths and misconceptions about the community. That's why people go from Shivambu therapy to so many cold water bath and so many alternative medications, and they do anything. Symptomatically, they may be having a relief, but underlying minimal persistent inflammation, the newer sensitivity formations, and later on they have a lot of complications. So by working together, the healthcare professionals and patients can improve the allergy treatment outcomes. And the simple like spirometry and all can be kept everyone, even many of the companies are supporting to the doctors whichever want to do the spirometry regularly. And some of the doctors have a oscillometry tests and all. They should be utilized properly so that the patients, once we show them how the lungs are getting affected, they will go for that. Then there are proper moisturometers to measure the moisturization in the skin. You can show the patient how see this your moisturization barrier is getting lost. You can have a use of that and that way. The PEFR meters, rhythometers. Patients of asthma and all, they can keep it and monitor that before the attacks come. And misconception should be removed, like inhaler, nasal sprays, even montelukast or pexofenadine or levocetirizine belastin molecules are very safe. Even a longer period also, they don't have any side effects. People have misconceptions that allopathic medicines with the side effects. So educate them, educate. Till we don't educate every one of us, they will have a lot of misconceptions. Once the education only brings out the proper concept of allergy management. And if we manage it properly, they can have a very good quality of life and they can get relief from the A. Only the misconception is that they want a cure. So the cure is not possible because this is a hypersensitive disease. Lifestyle, pollutants, so many things are contributed to that. So we can bring it from hypersensitivity to normal sensitivity, and the patient can have a normal life. So we can't reduce the mast cell to the zero level, like how we can't reduce the sugar to the zero level. The same way. So we have to educate the people about that. And that way, we can definitely achieve a very good control and complications also can be prevented. So prevalence into the pediatric allergies are very important. Suppose we manage the pediatric allergies properly, then these all complications, even to the food, environmental, drug allergies also can be. So while managing the pediatric allergies, options are effective education, shared decision making, and regular follow. Again, to have the children very comfortable for the allergy testing, there is a misconception the children may not cooperate. Nowadays, hardly 1 millimeter lancets are available. While playing, while showing some videos and all, we do the test on the arms and the back and all. The children also show very good. Then diagnosis wise, we can have a while talking or something, making them interactive, showing something, as well as the oscillometry and all can be done about 2.5 to 3 years. Allergy testing, as shown on the back or on the hands, also we do that. Very few patients may require a sedation, and conduct regular programs. The support groups can be there so that other parents, which are newer one, will have a confidence into the treatments. Telemedicines, like we can have teleconsultations to the people, build up their confidence. If anything, there should be a backup team. In any time, they should approach to our staffs, and then friendly environment should be kept so that the children are very happy to come there. Then keep a referral network, and the schools, the teachers should be made aware about this. Research and publications are very important. Show them the exact what is happening to have a very good results. And as I mentioned, the support groups, the NGOs, we can have online presence. Keep your blogs and all your websites up to date, and make a quality care with the safe, effective, efficient, equitable, timely, patient-centered medications, and then community outreach. So different type of programs can be for the health fairs, school presentations, or into the corporates and all. Then feedback, take the feedback from that. Any mistakes from our side and all, we can improve that. Insurance coverage, people like biologics and all now. Most of the these costly biologics also are covered under insurance. That also can. And CMEs to the referring doctors, family physicians, ENT, chest physician, dermatologists, and all. Allergy management, again, it can be life threatening. So, even the consumption of the food, it, if the patient had a prior history of significant anaphylaxis, if the child takes the food, don't wait for the multiple organ involvement. Give that and then watch it because that is can be a life saving also. And then the environmental allergen management, avoidance, and all those. Drug allergy also, very few drugs require a actual allergy test. Most of the time, the avoidance of that specific drug and the colors, additives, preservatives, and salts into that or excipients into the medications, they cause that. So just education and all will prevent so many unnecessarily blood drug allergy tests. Blood drug allergy tests are not useful. If you want to do, then the skin prick or intradermal or patch testing is useful. And communication to the parents and the relatives at a time bring them, otherwise the relatives will misconception and give a misinformation to them and give a false commitments. So rather than make them aware, and if the allergy care for the pediatric patient is given properly and the outcomes are good, then we can prevent the adult complications a lot. So burden of allergies is immense. We need a better management and long-term management also. In spite of no symptoms, the minimal persistent inflammation which continues with the newer sensitivities and all, that awareness should be there, people. Otherwise, the childhood asthma suppose is there or allergic rhinitis and it goes away. The parents feel that now it has cured. It is not that way. So always follow them repeatedly, check the nose and all. Even these children will require a influenza pneumococcal vaccines like PPSP23 vaccine is available about 2 years also in these allergy patients, and hib vaccine should be given. These are regularly required, even chickenpox and all, because they will have a secondary infection. They are prone. Th2 inflammation increases and the Th1 suppression happens. So again, the standardization of the testing and desensitization is important. Because there is many people they advertise and they go to the clinics also, even to the BMS, BHMS doctors clinics or anywhere they go and do the test. 10th or 12th standard managers. It's not useful to the people. Properly qualified allergy specialist should be there with a very good experience of that, then only the patient will can have a very good response. You see, this is a very good algorithm. Allergen exposure and avoidance measure, then depending on what type of phenotype, then the mast cell stabilization with the safer anti-inflammatory anti-allergics. Monoclonal antibodies, if there is a severe one which does not respond to the nicotine receptor antagonist or antihistaminics, or second generation should be preferred. Then depending on the runny nose and all, some of the patients localized nasal sprays also can be given. Decongestant in a very few specific, we should not give for more than 10 to 12 days. So it is a very good year, and then when it is needed, the immunotherapy gradually raises the patient tolerance to the allergen. That also can be big. So if you see this child which had a eczema and this was a like gingivitis, this was an anaphylaxis patient, this was a like repeated oral ulcers, and you can see the turbinate hypertrophy. This was a young girl with a severe vulnerable gingivitis. This protruded like bruxes are kept. This is because of the nasal turbinate hypertrophy. This was a young girl with anaphylaxis. You can see the turbinate hypertrophy, swollen tongue. This was a tonsillectomy was suggested with allergy management because it has been proven now in an early stage, if you operate the tonsil adenoids or DNS, they have a early lower airway problems also. So that is should be the last resort of allergy management avoidance measures and all. First, field eruptions. This was again urticaria patients with a dust mite sensitivity. This is again a young person with angioedema. This is the same child which was not treated properly. Then again had an infected eczema in the toddler age group. This is again a 7-year-old child with a sealed ulcer and all, requiring suggested for the intraocular steroids and all. And this was a 14 years with growth retardation, barrier shaped chest. All the things were done. And when we manage the dust mite and processes and the molds, within 9 months, the patient had a very good recovery. This was a 12 years with significant failure to thrive with repeated secondary infections, protruded mandible and all. And once we started managing the desensitization and the nasal sprays and nasal wash and safe ontulic acid with leocetirizine fexofenadine combinations like that. This was a young boy suggested like 2 to 3 admissions were there because of bronchitis, and 12 years he would have that. But the dust mite and the milk avoidance and all we gave, and within 9 months he had a very good recovery from that. This was a young boy with severe periocular and ocular allergy with the early age cataract and all. You can see in such a papillae. This was referred from one of the ICU. This child had an anaphylaxis-like symptom, but dust mite sensitivity was there, contaminated into the water. And so coming together, these are some simple examples, but it is increasing and the severity is also increasing. Coming together, we can definitely help the community and amongst us also. If you have the uniformity, the patient will have a proper faith on the research, scientific, and evidence based medicines. Thank you. Thanks a lot.